basically, it's a relatively minimally invasive way of ablating or damaging a part of the brain that is the source for seizures. It's a technique where we very precisely implant a very small laser fiber into the brain, and then using a technique called MR thermography, which is a very fancy way of actually live imaging the brain and detecting temperature changes, we can actually control the power of a laser to create an ablation of a target in the way that we see is appropriate and safe to try to eliminate the seizure focus, instead of having to go in and traditionally, go through the brain, get there, and physically remove that part.
So you have to know the target before you put the lasers in.
You do, yeah. You have to have a good idea. So there are certain conditions like hypothalamic hamartoma comes to mind, where the target is quite obvious and apparent and is deep in the brain, and something that, having a minimally invasive way to get there very safely is very useful. But if you don't know where to go, then you don't know where to put the laser, and also, if it's a very large area, then there are limitations in how much volume of tissue can be treated. So it's certainly a wonderful technique when used appropriately, and one that we consider for all of our patients if it's potentially useful.